All right, why don't we go ahead and get started? It's 3 o'clock Eastern time. Thanks everyone for joining today. It looks like we've gotten quite a great representation from the West Coast, especially in the islands. My name is Kate Moraras, and thank you so much for joining today's Hep B Hangout. I'm the Senior Program Director at the Hepatitis B Foundation and Director of Hep B United. We are a national coalition of about 20 organizations and local coalitions right now working towards the elimination of hepatitis B with a specific focus on the Asian American and Pacific Islander community. So on behalf of our coalition, welcome to today's Hangout, Get to Know Hepatitis B. The purpose of this Hangout and other Hangouts that we bring to you are really to highlight priorities in the field of hepatitis B. So we're really excited to be joined by our national and local partners today to discuss exciting new materials from the No Hepatitis B campaign. Just to give everyone a little bit of background about the campaign, we, Hep B United, in response to the staggering disparity in the rates of hepatitis B in the Asian American Pacific Islander communities. As you know, 1 in 12 Asian Americans and Pacific Islanders are affected by hepatitis B, and of the almost 2 million people with chronic hepatitis B, over 50% are from the API community. So in response to this disparity, we partnered with the Centers for Disease Control and Prevention, Division of Viral Hepatitis, to launch this multilingual national communications campaign known as No Hepatitis B. This campaign features a number of educational and awareness messages and materials, including PSAs, fact sheets, posters, infographics, and a variety of Asian languages that our speakers today will be talking to you more about. So I would like to go ahead and introduce our presenters for today so that we can go ahead and get started. We have with us over the phone Cynthia Jorgensen. Dr. Jorgensen leads the education and training team at the National Center for HIV, Viral Hepatitis, STD, and TB Prevention at the Division of Viral Hepatitis at CDC. Cynthia, do we have you?
We're here.
Great. And then we also have with Cynthia from the CDC Ms. Sherry Chen. Sherry is an ORISE fellow, also on the education and training team at the CDC. Hi, Sherry.
Hi.
And then here on the video chat with us is Mohamed Ali. Mohamed, you're a little bright, so you may want to close the curtain behind you a little bit. That's great. Now we can see you. Mohamed is the program coordinator at International Community Health Services, a qualified health center in Seattle, Washington. Serves a large proportion of the API communities as well as African immigrant communities. And Mohamed also coordinates the Hepatitis B Coalition of Washington, a partner, unofficial partner of Hep B United. So just to go back, if you are having any audio issues, you can also switch to the phone line, and the call-in number is right here. It's 323-920-0091, and the access code is 733-4209. And a few other housekeeping items. You are in listen-only mode for this Hangout. We will be taking questions at the end of the discussion, open Q&A period. If you have any questions in the meantime that you think of during the presentation, please feel free to submit those questions to the presenters in the chat box at the lower right-hand corner. Great. I'm going to go ahead and start with Cynthia and Sherry at the CDC. So tell us all about the No Hep B campaign.
Welcome, everybody. Sherry and I are presenting today on CDC's national education campaign known as No Hepatitis B. What I'm going to do is do an overview of the campaign and some of our successes from last year, and then turn it over to Sherry to talk about ways that we have tried to develop these materials so that you all at the local level could use them in the work that you do. As you know, the goal of the campaign is to increase testing for hepatitis B, As Kate mentioned, we've been pleased to join with Hep B United in a partnership and really rely on you all at the local level to help us implement this campaign. We are, to date, focusing on Asian Americans and Pacific Islanders, and have been fortunate enough to have the resources to do the campaign materials primarily in English, but in Chinese, Korean, and Vietnamese. We have a little bit of materials, not as much as in the main Asian languages I just mentioned, but we do have some fact sheets in that are in other Asian languages. And then recently, as many of you know, also we're able to come up with some materials for Africans right now in English and in French. Our objectives for the campaign are to increase testing for hepatitis B, but with our research we've found that there is a need for some key facts, including 1 in 10 Asian Americans are infected, that many people, as many as 2 in 3 people who are infected are unaware that they are, that this is a disease that often occurs with no symptoms, and that you need a blood test to determine if you're infected. Why some people know about the link to liver cancer, other people don't, so it's one way to emphasize the seriousness of this disease. And then we also want to decrease the stigma associated with being infected with hepatitis B. We have been able to have a broad range of campaign materials, from video PSAs, radio PSAs, banner ads, infographics, buttons and badges, e-cards, posters, fact sheets, a risk assessment. We have new templates for you all to use for flyers and ads, some provider tools, and I'm pleased that we are working with a top-notch Asian communication firm, IW Group, in developing these materials. So our approach is sort of twofold. CDC takes the leadership in developing and testing the materials. Many of you have provided us wonderful input in terms of what's both useful to you, but what's also culturally appropriate and competent. We take some initiative in terms of distributing the campaign materials nationally and in key Asian markets. And what we're here today on the Hangout is really to talk to you all about what we can do to partner together and make this even more robust campaign. So we rely on your input and your hard work to use some of these materials at the local level, and then we'll also be talking to you about just promoting your organizations and spokespeople to help get the word out. I know many of you know this, but we launched the campaign last year in conjunction with Dr. Ko. We're very pleased to have his leadership and his interest in this issue. And this slide sort of summarizes the different strategies that we have taken with this campaign. We've focused our print outreach in 7 U.S. cities in the 3 different languages you see, Korean, Vietnamese, and Korean. In TV and radio, we also look for very city-specific distributions depending on where the different radio and TV outlets are. We use news outreach, and this is where many of you on the phone or Hep B United members have been critical in helping us get the word out about the campaign and working with us in terms of press releases about announcing the event, and as well as using what are called MAD articles, which are sort of canned articles about the issue. We do work with IW Group to get banner ads in language, in Chinese, Korean, Vietnamese, and then we have a large social media presence. Our PSAs are on YouTube. The Division of Viral Hepatitis has a very active Twitter account. We use the CDC Facebook, and then we work with our partners at HHS for doing blog posts, including Dr. Ko. What we were able to do last year, and we're planning on doing it again this year, is distribute our TV PSA in Chinese, Korean, Vietnamese, and English to stations that match the particular language. We use primarily donated time for the PSAs, but we also have a small budget to allow paid digital ads that drive traffic back to the PSA. And one of the reasons we're using television is just that it can have the potential to reach many viewers and good for awareness building. So that's one of the main strategies we have. Last year, we got over 1,500 spots played. That translates to more than 113 million impressions, a media value of over 350,000. If you look at their YouTube views, one of the things that we were very interested in is you can see that the in-language YouTube views actually got much, much higher viewership than our English did. Part of that's where we place those ads, but part of it, I think, speaks to the desire for information in language on this issue. What we wanted to do, for those of you who were not at the meeting in D.C., is show our new PSA that's sort of the cornerstone of our campaign for this upcoming year. So I'm going to turn it back over to Hep B United to help play it for us, and then we'll jump back to our slides, and I'll be shortly turning it over to Sherry.
You'll do everything to protect your family. But don't forget to also take care of yourself by getting yourself tested for hepatitis B. 1 in 12 Asians has hepatitis B, and most who are infected don't know it. Untreated, hepatitis B can lead to serious liver problems, including liver cancer. But treatments can save your life. Hepatitis B is a virus that is most often spread through infected blood. It is not spread through air. People do not get hepatitis B from sharing utensils, bowls, or meals with someone who has the disease. Getting a blood test is the only way to know if you have hepatitis B. Ask your doctor about getting tested for hepatitis B. Loving your family starts with caring for yourself.
Thank you. We'll return now to our slides. I hope you have enjoyed that PSA as much as we have in both seeing how well it tested and as well as creating it. We had some excellent talent with our partners in IW Group to create that. We also have radio in Mandarin, Cantonese, Korean, and Vietnamese. We distribute the radio ads in select markets. Again, we use a little bit of our resources to pay for placement, especially in language. And some of the reasons we do this is drive time and call-in shows can be very popular. And one of our Hep B United members actually has a story about someone listening to the PSAs on the radio and coming in to get tested. Radio stations do cover a wide territory, and many of the in-language radios can be very influential in their community. So last year we had a limited paid strategy in which we had up to about 30 spots per week played in the various markets, which resulted in over 27 million impressions. We also use print. Here's an example of a paper in which we had our print PSA in, again in Chinese, Korean, and Vietnamese, like what you've heard before in select markets. Print tends to reach an older audience. It's good for a longer message, considered very credible. We had 6 to 8 insertions in various papers around the country, resulting in about 4 million impressions. And one of the things we want to talk to you a little bit about later is the Speakers Bureau, because this is a way that we can both promote the work you do, the work of Hep B United, and get the message out. So CDC and IW Group look for media opportunities, and here's an example that came out of the summit. And it's why we want to sort of help build the Speakers Bureau for both you at a local level, but also for us to get the word out on a national level. So this map represents cities where we have work in them. So the blue dots are sort of cities with different ethnic media, and the green dots are cities that don't have those placements or we haven't been able to go so far. And at this point, I want to turn it over to Sherry to talk a little bit about this and then transition to talking to you all about ways that we encourage you to use the materials and also ways we've learned from you that you've used them. So you'll see examples that we've actually learned from you. So we hope in the discussion you'll give us some more examples.
Okay, so thanks, Cynthia. Just kind of piggybacking off what Cynthia just mentioned, we really encourage you guys to, in some of these cities are the cities that we know have Hep B United coalitions in them. And if you are in one of the cities where we have managed to have media placements, we encourage you to take ownership of these PSAs and supplement them with your own ads. As Cynthia mentioned, we really value a partnership with you all, since you're the ones actually on the ground and have the impact into these communities. So with that, in the next section, I'm just going to talk a little bit about our resources, ideas, as Cynthia said, ideas that we have and that we've heard from you, and just some of our best practices and lessons from using these resources. So to start off, we have provider resources for healthcare professionals. They include serology guides, like guides that encourage people to test their AAPI patients, algorithms, and we encourage you to distribute these tools through listservs, email your providers, let them know. One thing we would recommend is reference the USPSTF recommendations, as we found in our focus group testing that providers are more likely to follow those recommendations than CDC ones. And we also have training courses on our website. So if you want to provide educational webinars or seminars on testing people for hepatitis B, you can feel free to use those resources. And then we also have fact sheets for consumers. So they're in all the languages that Cynthia mentioned earlier, English, Chinese, Korean, Vietnamese, Hmong, Khmer, Burmese, and Lao, and also the English and French ones for people from Africa. And also just as a reminder, we have perinatal fact sheets also in these languages. We also have risk assessment tools. We have a 5-minute online version that assesses people's need to be tested and or vaccinated for hepatitis A, B, and C. This is only in English, but we also do have multilingual paper versions that specifically focus on assessing somebody's need to be tested for hepatitis B based on a country of origin. We've heard a lot of people using these at screening events or just health fairs to quickly intake people and determine if they need to be tested. So here are our posters, which I think many of you already download them from our website or order from the warehouse. Continue to do that. You can put these up at clinics or use them as ways to draw people to your tables and booths at events. In addition to that, though, we'd like to encourage you to localize these posters. So again, you can just use the versions that you've downloaded or ordered, but if you need another file version, you can always ask us and we'll try to get them to you if you need like an InDesign file. We do ask that you keep the content and images the way they are and keep the CDC and Hep B United logos on the posters, but other than that, you can feel free to add any of the information that you'd like. We also have flyers for screening events, and that Cynthia mentioned really briefly earlier. These are just really easy ways for you to tailor these flyers to your local information, so you can add information you want to the boxes, to the white boxes, and just put them up as flyers or ads in papers or wherever you'd like to promote your events. So here are our PSAs. Again, they're available in multiple languages, and you've seen one of them earlier. We've heard that a lot of people play these PSAs on a loop at events or in settings when people are going to be waiting or just kind of like as an icebreaker or introduction to their seminars. So continue to do that. If you have internet access, you can just play the videos on a loop from YouTube. And if not, we do have the PSA files available on our website. You can just download them and save them to your computers and just play those if you don't have internet access at your event. So we also have buttons and badges that you can add to your website. They're just ways to visually depict their key messages in different ways, in visually interesting ways. So if you copy and paste them to a website, and when people click on them, it takes the person back to our website. So it's a good way to link back to our page. So we've also found through social media experience that people are more likely to pay attention and engage with posts that include images and videos and links, so just kind of more rich media content. So feel free to use our infographic and our snaggable content, like the buttons. They're just key messages depicted in a visually interesting way, and you can take those from our website. And on the subject of social media, these are just some of our best practices and key lessons that we've learned from our experience on Twitter, but many of these can also be applied through other social media platforms. So, like I mentioned, adding images and links and videos, using 2 to 3 hashtags, and using those helps us know that you're also joining the conversation. Shorten links, follow and engage with others, and if you want to host a Twitter chat or Twitter viewers on your campaign, we can help you with that. It's a good way to get engagement and broaden your reach. Also, schedule posts in advance and keep track of metrics are just kind of some of the tips that we've learned are really helpful. Okay. So also tapping into traditional media is important for getting your message out, as Cynthia mentioned earlier. And those of you who were at the Hep B United Summit in DC in May might remember some of these tips from IW Group, which is our communications firm. But again, just kind of developing relationships with local media by meeting with the publisher, inviting them as partners to events. It's really helpful. I encourage you to submit press releases and materials in the language that you want. And then buying advertising space if you have the resources for it, you can ask for a nonprofit rate. And if you want content to submit to advertise, you can always feel free to use ours or localize a flyer and submit that. So I just wanted to put in a plug for the Speakers Bureau and just really encourage you guys to tap into that by pitching. You can pitch the Speakers Bureau to local in-language media to get speakers on the air, especially since a lot of the TV and radio stations have talk and call-in shows on different subjects. And it's a good way to get your message out there and get the information out there about your event and your organization. And also think about other ways to get the media or to use the Speakers Bureau. So you can contact other organizations for speaking opportunities, like the Chamber of Commerce meetings or churches or other employee networks. So finally, we'd like to just encourage you to join the movement. You can add the Hep B United and No Hepatitis B logos to your materials, include signature blocks to your email signature. And those are on the slide. And you can visit our websites for more information, for more resources. And finally, send us feedback. Let us know what other resources you like. We really appreciate hearing from you on to know what is helpful for us to share. And also just share examples from the field and send us pictures, as Ding Pan from DC has kindly done. And with that, I'll turn it over to Mohamed to talk about localizing resources. Thank you.
Great. Thanks so much, Cynthia and Sherry. Great transition to Mohamed from the Hepatitis Coalition of Washington. Mohamed, we're really glad to have you here. And if you could talk a little bit about the Hepatitis B Coalition of Washington, your communities, and how you've made use of the No Hepatitis B resources at your events.
Thanks, Kate, and thanks, everyone. So for those of you who don't know me, my name is Mohamed Ali, and I am with International Community Health Services in Seattle. So today I will be talking about the efforts that we do in our state and also how we localize some of those materials that we used in May. So to go to the next slide, which is Hepatitis B Coalition of Washington has been at the forefront of the fight of Hepatitis B Coalition of hepatitis related health disparity in Washington State. Formerly it was known Asian Pacific Islanders and Hepatitis B Task Force. And International Community Health Services are also a federally recognized health center for clinics in King County area, an area that has about 2 million people. And there is a huge international community, refugees, immigrants from Asia, Africa, and also other parts of the world. Not only them, but also it is open to anyone. So in ICHS, they provide services in other health centers. So basically what I'm going to talk about is what we have done with hepatitis B. So the work that we do in this area, an area in Pacific Northwest, and I think we are the only groups in our area, including Oregon, Idaho, Montana, and Alaska. I've never had any coalitions or any groups that are involved in the fight of hepatitis B coalition Washington, so of hepatitis B. So we employ community health advocates who provide community-wide education encounters in the communities, and they provide one-on-one in large groups education. And also we do also offer hepatitis B screening and also provide vaccinations with the help of Hep Education Project, and also we link them to care. So what I'm trying to show you is in that timing, since 1997, ICHS, in partnership with Hepatitis B Coalition of Washington, developed materials starting from PowerPoint, brochures, and other materials to, are you listening? Are you hearing me? Okay, yeah. So those are the materials, for example, a material like this, which I have not provided in my presentation, which tells you hepatitis B, what you need to know, was a good example. And also there was another brochure that we give out in our educational, which is telling them living with chronic hepatitis B in English and also other ethnic language. For example, our materials, we have them Amharic, in Chinese, in English, Korean, Russian, Samoan, Swahili, Tagalog, and Vietnamese, and other languages also. We are keep on developing and translating and expanding into either East African language and also Asian communities. So that is the resource that we do have and provide continuously a community-wide health screening and vaccinating and connecting to care. So this is an example of community health fairs that we normally conduct. We table in the community organized, community-led health fairs, and then we table hepatitis B education materials that we developed with the help of public or privately funded grants. And also we provide with the help of other organizations or phlebotomists for drawing a blood and testing and giving the results. And that is what we do. So you see the second picture, which is Hep screening that Kim and I were conducting. And also it's not only for testing, and there's a lot of fun that we participate in our community in Washington State. So the community, since they took us to their centers, so dance and there's a food and there's a happiness in those days. So that is really what drives you, makes you happy to be part of that kind of timing where the communities are happy. At the same time, and you see in the lower picture where the community health advocates, they talk individually one at a time, and then while there's a lot of things going on with that event. So after that, and also there sometimes we got some funding from Gilead Inc., which is non-branded like posters. If you can see this poster, it's a poster that I got from our person in Gilead in Seattle. And it tells us, because we never had this kind of a resources, a poster. And what I'm trying to convey in this message is this picture is, if we would have gotten earlier from CDC or any other sources federally, I think we would have used it. But Gilead was there and they had it because they had a liver campaign or Be Aware campaign, which shows Africa or Asia or other maps and tells them people to find out their status, which is really good. And we used it and we posted in the grocery stores where the communities normally hang around. So those are the places people, when they see them and then they see our contacts, and then they come and ask us, so how will I So then that's the time how we connect people to the services they need. So when I get to know these hepatitis B resources at CDC or know how hepatitis B, KHB, and there was a lot of useful material. They are all useful, and they are needed really because it is really, it's a kind of redundant everybody or every organization or coalition or state to spend and recreate or those kind of things. Then really we liked it, and then at the summit, that is really the things that I shared with everyone. And in May, our Hepatitis Awareness Month, when we needed some material to translate, and then we used the CDC or KHB Materials, which we had in English. For example, this first flyer, it's in the English one, which shows you what we got from the CDC or from the campaign. And we try to modify it using the same content, but translated into the targeted language. For example, this one, we tried to translate into Somali, but the top part was kind of untouchable because of the technical difficulties. And then we wanted to continue on that kind of rate or the prevalence data, which is 1 in 12, that key fact sheet that Cynthia talked about. And also, when we wanted to target African communities, we replaced the Asian map into African map because it doesn't make sense while we are trying to convey the message to Africans and you are using the Asian map. And then, but it worked well for Vietnamese or other communities when we wanted to use the same material. So Vietnamese, there was a lot of products that was available in Vietnamese language that you prepared, but this special flyer was not available. And that's how we have to come up that translation. So we managed to translate into Swahili or Somali or African language. And this is an example. The top part tells you exactly the wording in Somali language. And the top part, the down part tells you the date and the venue for our health fair and testing date. And then we used, with the help of Mariko, our colleagues at ICHS, she helped me modified all these things because of her technical expertise. And the second one is the Vietnamese. And this is only one example how we modified and localized these materials that we got, which was really great help, because otherwise we would have recreated or spent a lot of resources and time and energy to make these materials in our area. And then we find also all TV ads or BSAs and infographics especially, which is really a material that makes great sense to refugees and immigrant community because of the way how it presents itself. People who have semi-literacy or illiterate even, they can understand the infographics because of the visual expressions of what's in there. And also I have seen the CDC in immunization work, whether it is measles or any other topics, infographics really is a way to go, and it makes life easier for us, the people who are at the forefront of this fight, to use it. And the blood test poster is also another good example. It's a good example. And also for Asians, if they have that big picture, and I would really recommend health centers to have that kind of a poster laying in front of the door, to make that in the mainstream, to make it a normal, a routine work for everybody to get tested. And also it gives the providers also that kind of a daily remembrance. Yes, Hep B, that kind of I would really recommend. And Dr. No, and many more. And also when it comes to this, take care of your liver with the Tato's image, it's really great use. And if we could get it, we could order in hundreds and thousands. It's only welcome. Yeah. So that is really what I would like with this product, and we have a lot of use of them. Thank you.
Great. Thank you. Thank you so much, Mohamed. I wanted to just remind folks, if you have any questions, please feel free to submit them in the chat box on the lower right-hand corner. If you have any questions for either Cynthia, Sherry, or Mohamed. Cynthia, I just wanted to ask you, I don't know if, I'm not sure if you covered this during your presentation, but can you talk a little bit about the origins of the messaging behind the campaign? For example, loving your family starts with loving yourself, I think. What was the, how did it test? Why does that resonate so well with the Asian American and Pacific Islander community?
We started out, good question, and what everybody should know is we are committed to testing our materials, both our slogans that you're referencing, Kate, as well as our actual materials. We started out with 3 or 4 different taglines and logos, both visual images as well as actual phrases, and tested them with members of our target audience, as well as got input from many of the Hep B United members in the first summit, and we selected the one that resonated most with our community, which is loving your family starts with yourself. As I think I'm preaching to the choir to say that family values and community orientation is very common in Asian culture, and we weren't surprised that that tested very well. We also would say that because we work with a top-notch Asian communication firm, they are obviously very tuned in and are hired by companies all over to do this very stuff. We're fortunate to be able to work with them. Absolutely.
Yeah, I think you are preaching to the choir. The family values does resonate the most with Asian American families. These are all really excellent materials, and just a reminder for folks, if you are interested in downloading them, they are at cdc.gov/nohepatitisb. Hep United also makes them available on our website at hepunited.org. I was wondering, what materials did you have in mind? Certain materials that have resonated more with individuals living hepatitis B? Are they targeted towards specific stakeholder groups, or such as people living with hepatitis B, or those those that are more attractive to ethnic media, or those that community-based organizations use?
I think I would really encourage those of you on the phone to look at the materials and pick the ones that most meet your needs. I think that's why we try to have a variety of materials. In general, we are focused on people who have not been tested. That's been our primary audience, not so much people who are living with hepatitis B. So when we go into focus groups, for instance, we try to screen people that either are unaware that they've been tested or don't have hepatitis B, because our behavioral objective is to get them talking to their doctor to get tested.
Right. So I wanted to ask Mohamed, thank you for sharing all of the events that you're doing, and thank you for your partnership. Have you engaged with ethnic media in the Seattle area at all, and have they been able to use these campaign materials?
And we used before this know-how KHB, I call it KHB Materials. Whether it is ethnic, I think we used a lot of print material, Chinese print, Vietnamese, and African also. And also we use a lot on YouTube. But I think in May, while we were working, I think there was a CDC telecast, which I'm not familiar with, which I think it was from KHB product maybe, that was sponsored maybe somewhere. I have no knowledge of it, but I think there was a timing that 3 days that whether it's local TV, CBC, or some other channels run a material that came from this material, which I think it was a great and it encourages people to show up in our hepatitis testing day on May 10th. May 10th. I think it's run, or May 19th, yeah. It ran from 16, 17, 18, 19th, yeah. It ran 3 days.
Great.
Yeah, I know it is very useful if we would have those kind of things, but the question comes, how can we, and what it takes to podcast in the TVs and also print.
Right. So good question.
We have a question from someone in the audience, which is, can we order the posters and infographics from CDC, and do we have to pay for them? Our posters that we have available for that are printed are free of charge. They're in our warehouse. Unfortunately, we don't have every poster there, so you can download them and print them yourself. The infographic, we encourage you to download and print that. So we don't have everything available for free for order, but we do have some of the posters available for free. Our YouTube video, we hope to go, the new one should be up, we're hoping in the next week or so. We're doing the final procedure internal to CDC to get it up, and that takes sometimes a week or two. And our posters should start to appear on our website also in the next several weeks. Once we sort of unveil the campaign, it does take us a few weeks to get them sort of in the system, if you will.
And Cynthia, what markets are the PSA slated to air in?
It depends on the language. When they're donated, we don't know. When we pay for placement, we're going into the major markets, New York.
We don't actually have the languages set yet for this coming year, but most likely it'll probably be like LA, New York, Houston, Dallas, many of the similar languages from last year, or cities from last year most likely.
Okay. And you're talking specifically about the Dr. No poster, right? That's the newest one.
Oh, for the PSA.
Yeah, the posters, we encourage you all to use them wherever you see fit, whether it's at a local level or if you can get them in your local newspapers. We're currently working with IW Group and also Weber Shamwick, who's our other contractor that we work with, mostly in English, for looking at placements for those.
Yeah, and I just wanted to remind folks to go back to a visual of the posters here. The one I think that the one that you see in the middle, that's the Dr. No that Mohamed referred to, and that's the new one.
Yeah, that's our newest poster.
Yep. And then the rest of them, they are already available on the website.
Yes, and all of the ones except the Dr. Co poster have been available in our warehouse.
Great. Well, thank you again. Just trying to see if we have any questions from the audience. Feel free to submit them to the chat box.
And certainly if you have questions after this, get in touch with Kate, Sherry, myself, or anyone from Hep B United or APCHO. We're happy to get your feedback or questions.
Great. And we're really, really excited about this new campaign and the posters, especially as folks, if World Hepatitis Day is coming up next month, July 28th. So these will be just in time to really promote that message amongst our community. We are, this partnership between our coalitions, which is comprised of community-based organizations, health departments, and provider groups, as well as academic institutions that really work on the ground with API communities. This partnership with CDC is so important because not many people that have hepatitis B know that they have it. It's really important that we do get the message out and that we have these materials available so that if you do work with communities on the ground, please do use these. It's important to just get it out there, whether it's in grocery stores like Mohamed had mentioned, or other businesses, Asian-owned businesses, or with your partners on the ground. We have another question from the audience. If we wanted to learn about how to reach out to our local ethnic media, could CDC or Hep B United help? And Cynthia,
and Sherry from CDC, we'd be happy to help and extend that assistance from our contractors. So we have had a talk that our partner from IW Group gave at the summit, and we certainly could have another either webinar or something in which we talk about how to reach out. And then I think we're all happy to give some individual technical assistance as needed. So, Kate, do you want to add anything to that?
Yeah. Just want to echo you, Cynthia. We're more than happy to help. Feel free to connect with us after this. I just wanted to. Sherry had put in a plug for the Speakers Bureau. I wanted to let everyone know that we will be posting more information about the Speakers Bureau on our website in the near future, so that folks know if you are connecting with ethnic media in your markets and you're looking for someone who is an expert on hepatitis B in the community, feel free to contact us and we'll put you in touch with them, whether it's a speaker to speak with the reporter or to do an op-ed, any of those sorts of things. If you're interested, if you know someone who would be interested in joining our Speakers Bureau, it could be anyone from a healthcare provider to a person living with hepatitis B, a community leader. Please do get in touch with us, and we're more than welcome to add to our Speakers Bureau. We did have a question. Is the Dr. No poster on the CDC website? Not yet.
Actually, it is, Kate.
It is? Okay.
Brand new, sort of, I think in the last 24 hours. Dr. No poster is up there. Our YouTube video is not. It's on the campaign website. It's not yet available. The Dr. No poster is not yet available for order. Our process is we have to have a purchase, agreement with money attached to it in order to print it, and then we go through several different steps before it's available to order for free, but it is one that we will try to get available to order for free. If you're having trouble finding it, we can send you the link. Either Kate, myself, or Sherry can send you the link to it. It is on the campaign website if you look at the materials. And we do have the Dr. No posters in 4 languages: English, Chinese, Vietnamese, and Korean.
Great. And, it's really important to just reemphasize that these materials, the ones that Sherry had talked about towards the end of the presentation, are localizable. As Mohamed has shown as a great example, you want to promote a specific event, and also your organization, and people may be more familiar with your logo or your information. You can do that with these new materials, use them as templates. Cynthia, could you repeat sort of the guidelines around localizing this materials, what you can and cannot do?
What we ask that you do is that you keep the CDC logo and the Hep B United and No More Hepatitis logo on, that you not alter the images, that what you do is just add information on, like testing event here, your clinic name, or that. Just so you all know, the art and images is licensed to CDC, and it's licensed for CDC to use, and we're extending that to you all by having you add on it. It does not mean you can take the images and then do something different with them.
Right. And these images have also been thoroughly tested as well. It was important.
The templates that we have for flyers that do not have the CDC logo on there, we have offered those to you all to use as you see fit. We have created those to try to have it easy for you to use and just have localized information just in one area on the white bar. If for some reason that's not working for you, you want to do something different, we can consider sort of requests that come in if you have a different need. And if enough of you have a request, then we can alter either what we've done so it meets your needs or create new materials that meets some of your needs. Our goal is to help you do your job at the local level and extend what limited resources we have collectively in Hep B so that we have good materials that we can all use and share with each other.
Great. And so I just wanted to go to Mohamed really quickly. Mohamed, do you have any pointers or tips for folks with your experience of using these materials in your community?
And I would share with the groups, I think given the Affordable Care Act implementation and with the rulings of hepatitis B screening and all those things, I think what's missing is if we could have used a lot of these materials, because which is really very hard to create by yourself if you are a coalition or anybody who's working on this hepatitis work. So this process helps us to make this testing a routine work, which is really the challenging part that we have with this immigrant refugee community because of that low literacy, low awareness, low. So these process, for example, the blood test or all these other information are really helpful because when I used some of them, people were really, because some of the images in this campaign is worthy of millions of words and hours of campaigning and outreaching to communities and also giving presentations. So one image of this really can help to reach something that we have been trying to reach hours and years. Thank you.
Thank you, Mohamed. Yes, absolutely. And he alluded to the fact that the testing message, you know, it's very coincidental and timely and serendipitous that the U.S. Preventive Services Task Force just issued a final recommendation, making it a priority, giving a high grade that hepatitis B screening be conducted, and that's a message that we're trying to get out to healthcare providers so that these materials, actually, the provider materials are also really important at this time. And we really would, every one of us, you know, including those on the phone and all the organizations must work together to get the word out. And Cynthia, we had a question pop up. Can we print the posters in black and white? There shouldn't be any problems with that, right?
There should not. We've tried to design the files and such so that they obviously are designed to be printed in color, but we recognize that not everyone has access to a color printer. So they should work well in black and white. If for some reason you're having trouble with that, let us know, and we can try to look into what we can do to improve the image for you.
Great, thank you. Any final questions from the audience? And Cynthia and Sherry, any final thoughts from you before we wrap up?
No, just if there's something that you need to help do your job that we haven't addressed, please let one of us know how we can help you. So we wanted to just have this chance to share some of our materials, share the ideas, as we've mentioned that many of which we've gotten from you. We certainly wish you guys well in your work in the trenches, and please let us know if there's something we can do to help you.
Thank you. And we really are so excited for these new materials, and we'll definitely be ordering those ourselves from the warehouse. If there are no further questions, we'll go ahead and wrap up. If you have any follow-up questions, I'll go to our contact page here so you can see how to reach us. Our email address is connect@hepbunited.org. Don't hesitate to contact us whether you have questions about today's presentation, about how to get involved in our Speakers Bureau, or how to connect with any of our spokespersons. We're also online on social media. We do post these campaign materials on continuously, so you can also get them easily there and download them from either Twitter or Facebook or on our website. Lastly, I wanted to thank